I am on my way to the Hairfront right now. Our case today involves a 75-year-old female, and she has a few comorbidities, meaning that she has a couple of medical issues. Those can make the procedure a little bit more complicated, and those kind of patients often require the presence of an anaesthetist to look after them and make sure that they're safe from a medical point of view. In-room sedations is quite interesting and can also sometimes be quite challenging. And the reason for that is you want to create an environment that is similar to working in a hospital, which is not always that easy. So sedation in the rooms requires quite strict protocols where all the emergency equipment, all the emergency medication is present in order to mitigate any potential emergencies. This is usually a low stress, low pressure environment for me. I feel that, I'm very comfortable working in these kind of situations. I feel that I have a lot of experience, but at the same time, one should never be so arrogant as to assume that you know everything or that you can predict outcomes. So I think it's really important to always be alert, always be aware, and treat every case as though it's your first, even though you have a lot of experience in doing this. Anaesthetists don't actually use stethoscopes that much. They just like the look. First priority is to go and check the procedure room. So what's important there is the equipment there. I test the equipment every single time. Is all our resuscitation equipment there? Are all our medications, including emergency drugs, is that all there? Once I'm satisfied that the environment is 100% safe, then I feel confident to move over to the next step. Usually what that entails is one of the transplant surgeons consulting with the patient, going through final rehearsal of the procedure and the expectations for the procedure. At that point in time, I re-engage with the patient and have a chat about what we already discussed telephonically. That's quite important to me, that that the patient interaction with me on the day isn't the first one. So we've already spoken telephonically, and I've obtained all the patient information. I've already planned the anesthetic and sedation protocol for the day. But nonetheless, we will have a chat and make sure that we are aligned with the plan. I'll check in to see how the patient's feeling, if there's any anxiety, if they need to be affirmed, if they need to be reassured about anything for the process. Hair transplant surgery is a team effort, and with that in mind, we have a really amazing team here at the Hairfront. It starts off with our receptionist and goes all the way into our procedure room. I'm going to take you through just to see what everyone is doing and how everyone contributes towards this procedure. Our lead surgeon, Dr. Lowland with the black cap, is obviously leading the procedure. Extractions are currently underway where individual grafts are extracted from the back of the scalp. They're placed into a special storage solution. They are cleaned and then implanted. I'll take you around to the stations in a moment. One of our technicians, Danny here, is assisting with the implantation of the grafts. The grafts are actually placed in a special device that allows implantation. And Teresa, to the left of Dr. Lowling, is assisting with that process as well. Savannah over here has a very important job of preparing the grafts for implant. She has little devices called implanters, and the grafts are placed individually in those implanters for implantation into the skull. Very important here that they are placed correctly and that the grafts are not damaged in any way. The technician that's so highly focused and concentrated over here is Nazia. She is cleaning and preparing grafts for implantation. Grafts that are received by extraction from Dr. Lolan are placed in a cleaning solution, transported to this workstation, and then under magnification they are sorted and cleaned and then moved along to the station where they are placed into implanters, which then get placed into the scalp. Wake-up process is just as important as any aspect of the sedation, and it's a very carefully controlled sequence of events where we bring the patient from a state of unconsciousness to a state of consciousness, ensuring that their physiology is stable, that they are pain-free, and that they are completely alert by the end of that process. Although anesthesia and sedation in the rooms is usually very calm and uneventful, one still has to bear in mind that there are very real and serious potential side effects that can happen. Allergic reactions, patient can have a seizure, a heart attack, and our training is geared towards managing those situations. So that's always something that you have to bear in the back of your mind, and you basically have to be prepared for any eventuality. Complications after sedation are very, very rare, fortunately. I have maybe 1 or 2 patients a year calling me after the sedation with issues that they may have, and most of those are actually related to the surgery. They might have some lingering pain, they sometimes may have some nausea. Most of these are very, very easily treated.